Hi, everyone. Welcome to Venturewoods Entrepreneurship Corner. Today, we have with us Nitin Gandhi from ShapeCrunch, who's founder and CEO of the company and has been doing great in the health tech space. We have with us Anshuman Gupta, volunteer at Venturewood, and myself, Amanmeet Garg, and we both together volunteer at Venturewoods for everything. Nitin has been a pioneer in the health tech space in India, and we happen to be alumni together at Tech. Um, and super excited to learn about his journey and what he's been doing so far. Without much further ado, let's just dive right in. So, Nitin, before we start, let's go with your background and your story so far. So, walk us through your background and who's Nitin and what's the story so far.
Sure. First of all, hi everyone, and Amanmeet, thanks for giving me, and Anshuman as well. Thanks for giving me the opportunity to speak my words out. So actually, you can say that I belong from a very middle class background. My parents have worked in a government service, and after that, I joined an engineering college, Punjab Engineering College, and I did my engineering. And as usual, as soon as I got out of the college, I went to a telecom company, a major telecom company, as a network engineer. But you can say that after 1 year of working over there, I realized that I love making products, and that's what I actually love about it. And over there at that point, and I was very much interested in getting into something which can provide a social benefit for the people, where the product is actually helping and solving a major need. At that point, I basically worked with another startup as well, but I realized that I want to do something of my own. And I love the fact, the whole journey of a product, that how it starts, how then, it is basically manufactured and how it grows. So the whole aspect of making a physical product and selling it always excited me a lot. At that point, you can say the first thing which I was excited about as soon as you can say as soon as I got out of the college was 3D printing, and the ability of 3D printing to make something which is in your head, creating something physical which is in your head, and that excited me and my partner a lot, who also went into the same college, and we graduated from the same batch. So soon we realized that this is something which is very very exciting, because now you can create something physical just imagining that this is something we want to make. So we started, the first thing that we started with the service company, where we started providing design service to a couple of clients. We got amazing clients in just 1 year. But soon, the as you say that when you're working in a service background, you always had that product bug. You want to make something which is something which can go to thousands of people, and which can solve a major problem. So we thought on this idea, at that point. How I actually started with this was I had a foot problem, and I went to the doctor, and doctor asked me, that you have a foot problem. This is called as flat foot. So now you have to go and you have to go to a workshop. You have to get some orthotics made. So, and then I went to that workshop where they took the foot impression, they did multiple assessment, and finally an orthotic came out, which was not as correct to my feet. And interestingly, then I again went back to the doctor, and he told me that, oh yeah, that happens in 50% of the cases. And I realized that making something custom is extremely difficult in this space, especially if you're making something custom for the foot. So we thought about it, and since we were already working into 3D printing, we thought that how about we create something which is fully customized according to the foot with 3D printing. So we did that, and then we again, we asked some of the doctors. They said that this is an amazing product, and the first thing that he said was, "May I recommend this to our customers, or you can say to our patients?" So I was quite surprised by his remark, because that was the first time we created something, and doctor wanted to use it for their patients, and it turned out, patients were liking that product very much. And then we thought about it, and we thought that how about we create something which can make the process very simple, where the scanning is very efficient, and which can make everything very very low cost. And making orthotics is like very expensive process, because it's very manual. The scanning process are very, very hard, and doctors can't have everything in their office. So what we did was we made a mobile app, and we just required 3 pictures of the foot from different angles. And using those images, we create 3D model using computer vision and machine learning, and then which is then 3D printed to create a final product. So this is how I will just show you the product. This is how the product looks like. This is the product, and then this is the insole which appears after the 3D printing. So this is there for different problems. So far, we have been working on this, and you can say, in short, that we created this company after that, and that is a whole separate journey. But that's what, as soon as we got into this, we started building on it, and then we made an app, and finally, which is being right now used by multiple doctors. So that is a separate journey, I can tell you. The next question.
Right. Cool. So that's pretty interesting that it was a natural problem that you had and you attempted to solve it, and it turned out that it's a problem that larger public also had.
Yeah, right.
So that's cool, because you basically took your technical drive that you had and you converted that into a product.
Exactly.
But what is the drive that takes you to entrepreneurship? Because entrepreneurship is a different ball game altogether than as a technical person solving a problem.
Okay. Yeah, that's actually a good question, because I actually sometimes think a lot about it, that what has actually driven me to entrepreneurship and why, why I'm into it. It's
Mm-hmm.
like, it's a basic, existential question, actually. So I actually think about it a lot. And whenever I see that why actually I got into entrepreneurship, I see, because this is something which drives everything forward. Consider, we got into it, we might be successful, we might not be successful, but the same concept would be used in thousands of other domains. Because I got into, I created something which is good, say 3D printing of orthotics with the help of app. In the next few generation, it will be either improvement of this process, or it will be, making this process better, or creating something which is like a replica of this process, or creating something which is forward thinking. And because I reduce the price of this, then everyone would like to produce it further at a lower cost. So where I saw myself, that I became a part of this evolution of something which is solving a big problem. Okay, so either it doesn't matter whether, I would be successful or not, but what matters is that I changed the game and I became a part of an evolution. So you
Right.
can say, in short, I found a purpose, and that's what, drives me a lot, that I have a purpose in my life. That after 20 years, if I look back, I will see that this was one industry which I actually, you can say, disrupted, so that things become way better than what actually was happening. Because if I may not be there, the whole process would be delayed by 5 years, or you can say would not be happening at all. So now everyone is thinking how to make this process much better. So I'm, as an entrepreneur, did a very good job, that I made a process which is easier, simpler, and made everyone to think that this is something which exists and this is something which needs to be improved on.
Right. Very interesting. Thank you. Thanks for sharing that.
Yeah.
Nitin, so one of the things which I wanted to ask you was, so ShapeCrunch looks like a very interesting product and is definitely solving a problem in the industry. Where do you see it going in the next 2 years?
Yeah. So next 2 years, right now what we are solving is, we are solving problem for people who have flat foot, plantar fasciitis, diabetic foot, and variety of other issues. So now the next thing is that what we are looking at is diagnosis, because what we see right now is, like having diagnosis is a big problem. The question is that how do you detect it early? Because prevention is more important in this case, because a lot of people who have this problem, they don't actually know that they have this problem, and they get to know it at a very late stage when it has already affected the foot. So right now we are working on the algorithms which can automatically detect, which can automatically tell you that your foot, you should either go to the doctor, or you should wear some other shoe, or change something in your foot. And second thing, in case of diabetic foot as well, we are adding we have an app called Shape Steps, and we are adding a sensor based sole through which we can detect that where the high pressure or low pressure areas are, to prevent diabetic foot ulcers. So that's what we are leading into. So far you can say that we were working a lot on the cure part of it, And right now where we are going is that how we can prevent the thing from happening.
Right.
Thanks.
So actually that's pretty cool that you're, now evolving into a diagnostic process. But if you were to take a step back, if you were to explain ShapeCrunch steps along the way and in summarize, what ShapeCrunch is, how does a consumer interact with ShapeCrunch? And, as you already touched on it, solving a problem, but
Yeah.
what is a consumer's journey like within the ShapeCrunch platform?
Exactly. So for consumer, I would divide consumer into multiple parts, like in terms of what they are actually looking for. So as a consumer, you are either looking for a comfort product, or you're looking for, if you're a runner or a sports person, you're looking for that kind of product where, where your performance can be increased and you become a better sports person. And third is if you actually have a problem, if you have a problem in your foot. So usually for people who have some kind of a problem in their foot, we have multiple clinics which are there on our listed on our website. They can go to these clinics, get the foot assessed, and submit all the data. So a doctor attaches a prescription in our app, and we provide them a very corrected and diagnostic insole, which can basically improve their biomechanics and do all kind of corrections so that they can walk pain free. So for the patient category, for someone who has the problem, I won't even call them a patient, but these are the people who have pain. We do everything so that we can remove pain by doing modification in our sole so that they don't feel any kind of pain and their biomechanics get stable. So talking about comfort and sports person, we provide them different kind of materials and density so that their performance gets much better. And even, if they're looking for comfort, they get extra comfort. For example, if someone has efficiency to stand in in a leather shoe for like 4 hours, with our insole, we have seen that has increased to up to 7 hours without any fatigue. So in that way, we make the biomechanics very efficient so that, your efficiency and you can say your fatigueness efficiency increases and your fatigueness decreases.
Right. So that's pretty cool. Because now that also, me as a technical person, it brings a question is that along this way of solving a problem that has not been touched in India before, you must have come across some great technical breakthroughs that you may have made, which not a lot of people may know about. Maybe you want to touch upon some of those?
Yeah, so I can tell you, for example, from because earlier, there was nothing happening in the space, and when we actually started encountering it, we got to know new things. Some of the things I can just tell you from just last 2 months only. We were actually testing our sensor app, where we had sensors and we had the sensor sole, and it was giving us the right pressure readings, that sensor sole. And it turned out, and we were in a clinic, and it turned out, we thought that this is a device just for foot, where we are actually checking where the high pressure areas are and where the low pressure areas are. But it turned out, we were able to see that people, if they have some knee problems, they are putting more pressure on one side of the foot because they want to avoid that, avoid the pressure over there, and that's why they are compensating it with by adding little more pressure over the other side, which is further which is further worsening the problem. So we actually thought that this is more of a product which we would use it just for the foot, but it turned out it's a whole rehab product which can be used for a lot of physical therapy needs, which can actually help you in gait training, which can help you in rehab training, and which can help you out in basically recovering whenever someone is injured as well. So this was one observation that I had that is coming into my mind. The second observation that we had was when actually we analyzed the data that we were actually had. It turned out 50% of the cases we just saw of two or three problems. These were like flat feet and plantar fasciitis. So and it turned out that every it's like it's a very common problem, but people really don't know about it. So although even the doctors or anyone are told about a couple of other cases, like con, callus and all, but in our data that the patients that we get or the customers that we are getting, 50% are like very small or minor problems, and this is what causing a lot of pain in the feet. And besides this, a couple of other things we also encountered that like for the different pain regions, sometimes, and sometimes it also happens. One of the observations that we did in our research, that people really don't know, if they have pain in that area. They are, like it might happen that the pain is because of some other problem and the pressure is somewhere else. So the pressure and pain are also not correlated, and it's very difficult to identify if someone has foot pain, that they are actually telling that the pain is in the right area. So these were some of the observations, and rest are the observations in the data, that how, like we analyzed that in Europe. One of the data observation was that a lot of people in Europe had more high arch as compared to, people over here in the Asian countries. So that was also another interpretation, that where, in which region people are getting major problems, in which region they are getting other kind of problems, and the feet sizes were also very different. So yeah, so a couple of you can say data breakthroughs which are coming in, and these are in continuous process. I hope to see more in future.
Great. That's awesome.
Nitin, just one more question from my side. So it's very interesting. You come in from an engineering background, and then you're working in a health tech space, which is fairly technical from a medical standpoint. So
Right.
was there a steep learning curve for you when you started this, and how did you manage that?
So I actually read a lot about this in terms of that definitely there is a learning curve involved. But the point is that innovation can only happen if people, or if I talk about radical innovation, can only happen when people from different background come together. When people from same background are working together, you can say that they'll be all saying the same things. So what we did was we worked with a lot of doctors, and our goal has been so far, to work with the best clinical and technical minds, so that we can gather their views. And so far we were actually very lucky, being young and being an entrepreneur. That is the benefit. Everyone allows you in the office to discuss something new. So that's what we learned. We actually are always connected with the doctors, with the physios, and we ask them that give us the feedback on the product, how we can make it better, how we can, and what are the other problems you are facing. And that's the product development approach we have. As you can say, what I believe, that when we are making products, we are always, going to all the, all the network of clinics we have. We ask them, what do you think about this feature? What do you think, what are the other problems you're having? And that's what makes it very, very simple for us. So I would say that the learning curve has been that it's the network that we've made. And that's what, the whole the decisions, our product management decisions, you can say the doctors are the one who are actually helping us out in the process, because they clearly tell us that this is what patients need, and we just implement that in our like in our platform.
Thanks, Nitin.